Thanks, June. So, my name is Pavlick. I'm an RN, and I am the new workplace wellness nurse for ACMC. And May happens to be National Sleep Better Month, so I was asked to do a presentation on that. So some of the objectives today is going to be to review the recommendations by the Better Sleep Council for better sleep, review potential long-term medical effects of poor quality sleep, discuss tips to help get a better quality night's sleep, and discuss benefits of sleeping in a cooler room, which is going to be the main focus of our talk today, and how to get help with sleep disorder. So the Better Sleep Council, so it's recommended that about 7.5 to 8.5 hours of sleep a night is optimal. Refreshing sleep is critical for optimal health, as sleep was found to be vital for physical, mental, and emotional health. So just to make sure you guys are paying attention, any idea how many hours of sleep is recommended?
7.5 to 8.5.
Good job. Good job. Everybody's awake still. Long-term effects due to inadequate sleep are an increase in stress hormone production and high blood pressure. How many of you guys can relate to that? High stress levels. The body's stress level rises when it does not get enough sleep. Some consequences of continued poor sleep include mood swings, reduced concentration, a weakened immune system, and irritability. And then sleep deficits are closely associated with weight gain, diabetes, high blood pressure, lower tolerance of chronic pain, serious sleep disorders such as restless leg syndrome, sleep apnea, insomnia, and narcolepsy. Long term, you can also add on to that list, that nice list there, heart disease, obesity, depression, and again, concentration difficulties. So here are some tips to help get a better quality night's sleep. And we all want to sleep like this dude, right? We need a nice mattress to do that. So we want to establish a consistent sleep schedule by sleeping at the same time each day of the week if possible, including the weekends. No hard partying on the weekends, guys, okay? 6 hours of deep, refreshing sleep is more beneficial than 8 hours of light, interrupted sleep. Hannah, I don't know. Is that happening? No, okay. So one of the keys is to relax before sleeping. You want to, limit any stimulating activities such as exercise, and I mean like hard exercise, working, scrolling social media. I'm going to get a little bit more into that a little bit further in. And then perform activities that you find relaxing, such as reading, meditation, even yoga can help that. So here's some more tips. Anybody got a dog? Anybody's dog sleep with you?
The cat does.
The cat? Okay. I didn't have one with a kitty, so if possible, you want to remove any distractions. I'm not talking about your pets, okay? Such as computers and TVs from the room, lights from alarm clocks, TVs, cable boxes, and other electronics may impact your sleep. So you want to identify where those sources of electronics light is coming from and strategically place or cover them so they don't affect the sleep, if that's possible. And it's because that the blue and green light from the TV, from the computer, from your tablet, from your phone can actually neutralize melatonin effects. And I'm going to get into a little bit more about what melatonin does and how that benefits your sleep here shortly. So you want to keep your lights low before bedtime. You want to turn any of the bright lights off, and you need to be at least, if you don't turn your TV off, at least 6 feet away from your TV. And then, of course, you want to ensure your bedding is adequate and that there's enough space in the bed, especially if you're sharing with a partner or a pet. So main topic is going to be benefits of sleeping in a cool room. So getting a restful night sleep is top priority for many of us, and knowing that something as simple as sleeping in a cooler room can help do that, and it's easy to implement. So some of the benefits of sleep: it helps your brain work properly, it helps to improve learning, maintains balanced mood, supports healthy growth and development, keeps your immune system healthy, and it increases performance and productivity. So tip number 1, how to fall asleep quickly. We want to sleep like that, comfortable, restful. So as nighttime approaches, body temperature starts to drop, and that's the signal that it's time to slow down and get some rest. So by keeping your room cooler, you're reinforcing your body's natural desire to start that sleep process. If the room is too hot, it could potentially block that signal, making it take longer for you to get comfortable and to sleep. So while individual preferences vary, the ideal temperature is between 60 and 67 degrees, and that resembles a comfortable, natural sleep environment. Otherwise, you're throwing your covers off and everything else. So, another tip for better quality sleep. How many of us have been there? July, August. If you ever woken up in the middle of the night drenched in sweat, that's just, you're not comfortable and you're up and you're not getting rest. So keeping the bedroom cooler helps regulate the temperature through the night. You'll find that sleep quality will improve. So by keeping the room cooler, it can improve the quality of sleep by stimulating melatonin production. And that's, believe it or not, a hormone to help you promote sleep. So melatonin increases when it's dark, and it decreases in light. So it puts you in a state of quiet wakefulness to help promote sleep, and it starts actually activating about 2 hours before your bedtime. So once you get into that routine of going to bed at a certain time every night, about 2 hours before you start to get into that routine, that's when your melatonin starts to get into effect. It doesn't make you sleep, but it puts you into a state of quiet restfulness. Sleeping in a cool room can help combat insomnia by lowering your body temperature, which slows down your metabolism rate. And as a result, energy is spent during sleep is lower, and you're less likely to wake up in the middle of the night. Another benefit getting a good night's sleep is anti-aging. I thought this was really a cute little slide here. The cooler room encourages the body to produce melatonin, as I've said. In addition to promoting sleep, melatonin is also a powerful anti-aging hormone. Most people produce enough melatonin to sleep on their own, but if there are supplements out there that can help with that, if you're not feeling that you're getting enough restful sleep and you think you might need an aid or something like that, there's over-the-counter melatonin to help that. So other benefits of increased melatonin production are regular menstrual cycles, enhanced moods, weight loss, cancer-fighting properties, and increased brain health. So melatonin can help program your body to produce the melatonin at night, and that happens by actually going outside during the day and getting some daylight. So if you get enough exposure of daylight in the morning and afternoon, that helps to promote also that cycle of starting to get that restfulness around 2 hours before you start to sleep. Just a side note about melatonin supplements is if it doesn't help after 1 to 2 weeks of trialing it, then stop using it and consult your healthcare provider. It can be safe for about 1 to 2 months trial, and then stop and see if it's working. Stop it, see if it's helping your sleep. If you're back to not getting restful sleep, then you should probably talk to your healthcare provider about other options. And then, as a note, do not use it pregnant, breastfeeding, if you have an autoimmune disorder, seizure disorder, or depression. Any questions so far? Yes.
So you said about the blue light on your tablet, so what if you read books on your tablet? Is that the same thing, or?
Well, yes. So you kind of, yeah, I think when from the literature that I saw, I think when they're talking about reading a book, they're talking about a real book. You know, you probably, if you're reading on your tablet, you want to stop that probably at least an hour before you're ready to go for the night, get some rest.
Because now all the books are on your tablet.
Not mine, I still do the old-fashioned way.
Special light
They have the dimmers on there too.
on the tablet?
Yeah.
Absolutely.
Check your settings. Yes, sir.
I got a big clock in my bedroom. It tells the time, and it lights up pretty good. Should I cut that thing off?
What, can you dim it? The question was, he's got a big alarm clock.
Right.
Yep.
I
Can
might need to, because it's bright.
Right.
either that or move it a little bit further away from you. Is it right next to your bed?
No, away from the bed.
If it should, anything bright light should be at least 6 feet away from you. Okay?
I never thought about it.
No, I have mine.
Okay.
No, I know my mom, she thinks.
It can help. Anyone heard of beige brown fat? Anybody? Nope. Yeah,
Wait, what did you say?
beige brown fat. Have you ever heard of that?
Yeah.
Okay. Good. Was hoping somebody did. So, sleeping better at night can also help with weight loss. Sleeping in a cooler room can help with weight loss goals. Again, when the room is set to an optimal cooler temperature, the body produces melatonin. It's the star of the show today, in case you couldn't tell, and will cause the body to store beige fat, which helps you burn calories instead of storing them. And actually, let me go back. So when that beige fat, they're called beige adipocytes, and they expend energy to generate heat during cold exposure, and that's what stimulates weight loss, and it helps promote resistance to obesity. So I learned that when I was putting this all together. Okay, decreased risk of disease. So, with the phenomenon of beige and brown fat increasing in cooler temperatures and causing the body to burn more calories, it also increases insulin sensitivity, which lowers your risk of type 2 diabetes. Diabetes isn't the only disease that a cool room could help combat. The increased melatonin production also could have a positive influence on Alzheimer's and other dementias. Since melatonin can improve sleep, this could lower one's risk of dementia. As a caution, experts do not recommend giving melatonin to elderly people already living with dementia due to a higher risk of falls and other accidents. So, another tip for a cooler room is it helps prevent insomnia. Whoops. Sorry about that. I went too fast there. A stressful day and an overactive brain aren't the only things keeping one awake at night. According to the experts, one of the potential symptoms of stress is elevated body temperature. Remember we talked about that a few slides back. So bodies cool off at night in anticipation of sleep. However, if your stress level's elevated, then the body's going to be hot due to stress. The environment will need to be adjusted to cool down enough to signal to your body that it's time to rest and go to sleep. So, a good night's sleep enhances mood. I'm sure some of us have all experienced all those right there, all them little sticky notes, right? Go back one. Oh, I'm missing a couple things in that slide right there, but that's okay. I can read them to you. So it reduces stress. So there are ways that sleeping in a cooler room can enhance mood. The cooler room improves the quality of sleep, and you wake up more rested and feel better. The link between melatonin and serotonin. Serotonin is a known mood enhancer, and it's the precursor for melatonin. So that means that melatonin is made from it. When the body has enough of both of these hormones, then we rest better and we feel better. So serotonin is the makes you feel good hormone. So they both kind of work together. So another good night's sleep reduces stress levels. And many of us have kind of been in between there. Similar to the mood enhancing effects of cooler temperatures in the bedroom, getting a higher quality of sleep reduces stress all day long. When you sleep better, then you are able to adjust better to what's going on in your everyday work life. Chronic stress can lead to long-term health complications such as depression, stomach problems, muscle tension, weight gain, memory, and concentration difficulties. So some ways to alleviate stress. I've mentioned some of these before already. Read a good book, some meditation, humor, and exercise, just not before bed. Okay. A little bit more on stress. Anyone feel like this sometimes? Your brain's just on overdrive. You got too many tabs open on your computer or your phone or your tablet. Just like too many things, just too many worries, such as elder care, child care, family conflicts, problems with personal relationships, financial relationships, concerns, and other anxieties can all interrupt a healthy sleeping pattern. I know that was me last night when I was worried about coming in and doing this presentation today. Want to make sure everything was good. Some physical factors which can affect sleep include pain, excess sweating, getting up 50 million times to go to the restroom, noise, including snoring by your bed partner or pup, and your light levels in the room. So, does anybody have an idea what happens in our bodies when we sleep?
So the cellular repair.
Pardon me?
Sorry, full of crackers. Cellular repair.
Correct. So there's a lot going on. So I'm glad you mentioned all that. So here's a timeline of what goes on when you're sleeping. So if you go to bed around 10 o'clock, maybe a little bit earlier, but like you said, that your white blood cells start to double and your body temperature falls. About an hour later, you start restorative process starts happening, that cellular repair. We're finally starting to drift off into a lower level of consciousness, and you're starting to dream, but the brain's still going, of course. You're kind of in a light sleep about 1 o'clock. 2 o'clock, the organs are all resting except for your liver and your heart, and your brain a little bit too. Your arterial pressure is lowering, the pulse and breathing slow down. About 4 o'clock, we start to, not quite ready to wake up because it's resting too. Hopefully you're, dreaming a good dream and not uncomfortable. About 5 o'clock, kidneys are resting, our muscles are real relaxed and they're sleeping. 6 o'clock, that's when the body starts to say, oh, hey, might be time to start waking up. And then about 7 o'clock, the immune system, moment of glory, because that's what time we, usually get ready to start getting moving on for the day. So, a lot happening. Again, when it's dark in your room, that process that you sleep better. So, achieving better sleep through lifestyle changes and stress reduction. In many cases, better sleep can be achieved through lifestyle changes and the way we think about things. Better Sleep Month helps to make people aware of any poor sleeping habits. Organizations which support this awareness campaign give advice and support on how to improve sleep. Counseling can help address any personal problems which are causing stress. Relaxation techniques can be taught to help counteract those effects of stress. Some more. So let's keep going with that. There is recent evidence which suggests achieving better quality sleep is maybe more important than increasing the number of hours sleep. Anybody ever like say, oh, I'm gonna sleep in, and you sleep in for an hour and a half or 2 hours after you normally wake up, do you feel any better?
No.
Not really,
No.
right? Not really. So you get better sleep, that's what your body needs. It needs some good sleep. Okay. The National Sleep Council, which supports Better Sleep Month, has reported that people who sleep between 6 and 7 hours a night actually live longer than those who sleep for 8 hours.
Wow.
Yeah. This was the Better Sleep did a survey back in 2008. I didn't have anything more current at the time here. That conducted a survey on sleep and productivity in the workplace. The results showed that the main consequences of lack of sleep, and in the workplace, not at the workplace, so it's okay, included a huge decline in the quality of work, judgment, and concentration. It's estimated that poor sleep costs U.S. businesses about $150 billion through absenteeism and lost productivity. So not getting a good night's sleep affects our productivity during the day.
I have a good one. I found that.
You do, yes. All right, so let's review some of the potential long-term effects of poor sleep. So medically, do you feel tired in the morning, even though you got a good full night's sleep? Does your significant other complain about your constant snoring? If you answered yes to either question, you might have a sleep disorder. So, 40 million Americans have chronic sleep disorders, and 20 million more have trouble sleeping occasionally. 1 in 3 Americans is so tired that during the day that it interferes with their work activity, their driving activity. So if left undiagnosed and untreated, those disorders can lead to hypertension, cardiac, and other serious conditions such as heart disease, diabetes, obesity, depression, concentration difficulties. A sleep study can be performed. It's a medical test that's performed while you sleep at night in a very comfortable, private room environment. This test is used to evaluate and diagnose a sleep disorder. They're safe, non-invasive, and they provide valuable information for your physician. I found out, and I learned this too, because I'm not familiar with everything that's in the area yet. Ashtabula County Medical Center has a Center for Sleep Medicine that can provide that environment. So just a couple things to review. There's several treatments for sleep disorders depending on whether your condition is moderate or severe. Treatment options include diet and losing weight, sleeping in an elevated position, wearing a mask that forces air into your lungs, such as a CPAP, that stands for continuous pressure airway, or maybe nasal surgery. That's always a possibility. And usually sleep studies are covered benefit under most insurance carriers, and these studies are usually done on patients older than 18. Always check with your provider, your healthcare provider, and your insurance carrier as to whether they recommend, where they recommend that evaluation to be done. So I put a little information about Ashtabula Medical Center for Sleep Medicine. So it's a state-of-the-art sleep testing equipment. They do a pulse ox, which measures your oxygen level. They also do an ECG. That's to help record what's going on in your brain while you're sleeping. Use of pressure transducer to monitor your airflow. Your studies are usually looked at within 2 business days, and then for the most part, the physician at the sleep center as well as your personal physician will review that information. So if you have any questions or you need to make an appointment for a sleep study, talk to your physician first. Find out, if that's something that, hey, I wake up in the middle of the night. I wake myself up in the middle of the night snoring, or I don't feel like I'm getting enough rest. I'm tired all the time. So those are some of the symptoms you need to talk to your doctor about. So, because in order to go for a test at the sleep center, you do have to have a physician's order, all right? And then they will look through your test results, and then they will recommend a treatment that will best meet your healthcare needs. All right. Oops, go back there. Any questions? Okay. And there's just some resources. If you need a printout, just ask Jude. She can get it for you. And that's it.
Well, that's good.